mammogram remains the golden standard for detecting breast cancer.
But research shows that it's not as effective in all women. So we have Dr. Brian Baer here today to discuss what's new in the fight to detect breast cancer. And so what are the limitations in detecting breast cancers?
Well, 40% of women have dense breasts, and we have a graphic here that shows that not all breasts are actually created equal. The breast tissue itself, if it's dense, can actually delay diagnosis and worsen prognosis. So therefore, we're very interested in these women who have dense breasts and getting accurate diagnosis. And mammography alone can miss up to 30% of the diagnosis in dense breasts itself.
This is what you're talking about?
This graphic shows on the left is a very nice normal breast, and on the right it's extremely dense, and that can limit what you see within the breast tissue.
So how do radiologists kind of overcome this hurdle to obtain better diagnosis?
Well, when they see dense breasts on mammography, they immediately go to ultrasound. And of course, this immediately creates anxiety in the patient. And the technician uses a handheld device, and it takes a little longer for them to get all the appropriate images. And this also can create more anxiety in the patient as they're waiting for the radiologist to look at these films.
But education has to be key, because I know exactly what you're talking about, that anxiety when they say you've got to go beyond a mammogram. But if we know that we may have a dense breast, or just have more education about it, it may calm our fear?
Correct, because you're prepared for that type of study then.
Okay.
So how do you have that conversation with women that are coming in? You talk about this and what's available to them.
We talk about what's available, and what's really interesting is, like in surgery we use the robot, now in ultrasound there's a new device that has been invented or produced by GE Medical, and we're showing the graphic now of what the device looks like. It's called Automated Breast Ultrasound, ABUS. And what it does is it takes all the technician-dependent error out of the picture. It's extremely fast, it goes over the surface of the breast, and it gives the most amazing images to the radiologist to actually look at. And the radiologist, the software is phenomenal as well, can look at the images almost three-dimensionally, and it increases the pickup rate. What the preliminary studies have shown is that it increases the pickup rate of 55% invasive cancers over mammography alone.
Oh.
Wow.
So it very well could become the mainstay of breast evaluation in the future.
And again, when should women start having their mammograms?
Well, there's a lot of, we could talk for an hour about that, but right now I recommend at age 40.
At age 40, okay.
All right, if you have a question for our experts, email them at asktheexpert@todaystmj4.com. You can also leave a voicemail. That number is right there on the screen.